Theo Versteegh, thank you so much for coming on to Life After Impact. Welcome.
Thank you so much for having me. I'm excited to be here.
Yeah, I'm so excited to learn more about this device that you created. In the world of concussions, I think you're one of the few people who's really doing things to try to prevent them in the first place. So, why don't you tell us a little bit about your background and kind of how you started Topspin Technologies and this device that you created?
Sure. So I'm a physiotherapist by training. I've been practicing predominantly or almost exclusively in sports medicine, I guess, for over 25 years now. And at the last clinic I was working at, I was one of two sport concussion specialists. My interest began back in 2011, and it was I don't know how many of your kind of audience are hockey fans, but Sidney Crosby had a very significant concussion back in 2011 that
Hmm.
it ended up keeping him out for almost a year. And it the idea spawned where all good ideas come from, which was at the bar after playing rec hockey myself. So after a few beers, when you solve all of the world's problems, and they were showing that like the injury. The previous one, that 4 days later, he was re-injured, and myself and my I guess teammate from hockey, he was also my strength and conditioning coach back when I played football in university, and we got chatting, and that hit. It was quite noticeable how his head just whipped around like it wasn't even attached to his body. And certainly back when I played football, we had somewhat archaic, but the four-way neck machine. So you push forward, push back, and side to side.
Yeah. Hmm.
And we got talking like, oh, if his neck was stronger, his head wouldn't have flown around like it was on a bobblehead. And that kind of got us thinking about just kind of neck strengthening in general, and kind of brought back to the four-way neck machine. And with my physio background, I was thinking, okay, like, well, that'll strengthen it going forward, back, side to side, but it's also that kind of rotational impact. And further, it's also kind of that fast eccentric load. So where the muscles are contracting, but they're getting longer, so they're absorbing the load, they're not generating the load. And it's a very different type of contraction that you can't really get with doing a traditional four-way neck machine. And so it got me thinking, as a physiotherapist, and kind of key components of, if you were to train the neck to protect and stabilize the head in space, what would that look like? And again, the key thing is to strengthen the muscles eccentrically, but concussions are also very fast events, so you're going to have to kind of get kind of the speed of contraction involved. So you're focusing on the fastest twitch muscle fibers, which are the type 2X fibers or the type 2B fibers, depending on when you do your training, and which are 3 times faster than the type 2A fibers. And traditional neck strengthening, you end up focusing on those type 2A fibers, which are notably slower. Um, and also, the neck is an incredibly complex neuromuscular system, and it doesn't just move the head in single planes of motion, kind of forward, back, side to side. Like it is, we are constantly, if you're playing sports, your head's on a swivel, and it's that rotational direction that's really key for stabilizing and protecting against potential head and neck injuries, because we're quite unstable statically in that, because we don't have any structural stability to prevent rotation, because it's such a key movement that we've got to be able to do very quickly, and we can't have it restricted. At the same time, it ends up being very prone to injury for that exact reason, because you either have mobility or you have stability. So
Mm.
with that, kind of a lot of kind of thoughts, and it's like, wow, that's a pretty tall order of training in order to properly train the neck to stabilize the head in space. Was playing around with for a few months, just kind of different approaches and concepts, and I just happened to have, with another kind of concept I was working on, what ended up being an axis on top with a weight, and it kind of swung around, and I was like, oh my god, this is exactly what I'm trying to
Mm.
achieve. And that was the inception point of what is now the Topspin 360.
Gotcha. Well, everything you just said makes so much sense about differentiating between, fast twitch fibers and slow twitch, and obviously in sports. And, I did a lot of martial arts, and I have a very long, thin neck that I probably lacked the needed strength. And so when I got punched in the face, I mean, there was a ton of rotational forces, and those are coming at you very quickly. Nobody's punching you in slow motion. So
Absolutely.
it makes sense that you would need to train something and to actually strengthen those fast twitch muscles versus, just those machines that people go through where it is a slow controlled motion that maybe isn't the exact replica of what you need when you're in a sport like boxing or martial arts or football or
Absolutely, because these are like ballistic, high impact movements, and training slowly, isotonically in a single direction, it doesn't translate. I mean, this, for the strength and conditioning coaches in your audience, it's the SAID principle. So specific adaptations to impose demand. Just as in order to train to be a world leader in 100-yard dash, you don't train by running marathons.
Mm-hmm. Yeah,
You
exactly.
got to mimic that in some capacity. And the other thing is it has to be safe. When you're doing it, theoretically, you could, like just do lighter and lighter punches and just kind of build up the strength of the punch. But what if, the person's fatigued and you go to that next load, you're causing the injury that you're trying to prevent.
Yeah. Okay. So I've seen pictures of your device. It kind of looks like a helmet, almost with a little boom that comes off of it, and that boom is weighted.
Yeah.
And so, talk to me about kind of what this looks like when people are using it. What types of movements are they doing? I saw a little video of you folding some laundry, I think, and
Yeah,
using
that's
it
right.
while you're folding laundry, multitasking at its best.
Well, it's exactly. So it's got a centrally mounted axis, and it, as everything does these days, it has an app. So you turn the helmet on, and you pair it with the app, and it brings you to the training page.
Mm.
And so, I'm just going to do a demonstration. I'll kind of walk you through what I'm doing for those who are listening. But essentially, it's a centrally mounted axis on the apex of the helmet with a small weight that is free to spin in the full 360 degrees. And once you've kind of popped the helmet on, securely fitted, you press start, and then the app just merely counts the revolutions and also calculates out the centripetal force that's generated, which is mass times velocity squared over r. But we're not just interested in the force. We want to know, there we go, the rate of force development. So how quickly can that neck generating multiplanar stabilizing force? And that's really kind of the metric that we wanna know and quantify is how good is the neck at stabilizing the head in all directions of motion.
Mm-hmm.
So with that, it ends up being force divided by time, which is rate of force development. So in pounds of force per second, and then the app afterwards shows you your best rate of force development in a clockwise and counterclockwise direction in pounds of force per second. So that is, a direct measure of the neck's multiplanar dynamic neck strength and stability.
Okay, awesome. So not only are you using it, but the app is tracking a lot of different metrics to be able to show improvement over time as far as stability. And now you're not necessarily moving your head that much, but you're moving it quickly.
That's right.
Yeah. And then in terms of I know you've been doing some research on this, and you've actually found kind of some incredible outcomes in terms of sports teams that are implementing this. And by the end of their season, like there's 0 concussions.
Yes, it
So
is
talk to me about that.
uncanny. So we've had like now multiple sports teams across both genders and multiple sports that after implementing training in many cases drop down to 0 head and neck injury seasons the following year. But also pretty excitingly is so far in I think every case within 3 years of adopting Topspin360, they've gone on to win their conference championship.
Okay, so you're not just preventing concussions, but somehow you're improving sports performance.
Performance. And it like, and we've been doing so looking at the actual statistics because that was I did my PhD researching in multiplanar dynamic neck training, so unfortunately I had to do a bunch of statistics, and you learn how to analyze that stuff. And Yeah, like I mean, the results are really hard to argue when you look at kind of pre-topspin and post-topspin, the number of wins, and then the increase in championship. There's a 3.5-fold increased likelihood of winning a championship after implementing topspin compared to before.
Well, that's a motivator for a team
Yeah.
to adopt this technology. And how much time are people spending actually using the device, like per day or per week?
Yeah, so that's the other thing is I'm very fond of the minimum effective dose
Hmm.
and high intensity interval training. So it's 2 minutes of training twice a week is the kind of the studies that we've done, and quite dramatic and substantial improvements. Specifically, the outcome measure we've been doing is multiplanar static neck strength. So we do just look at flexion, extension, right, left side flexion, right, left rotation strength. And the average improvement in all of those directions, so composite neck strength, is 1% each 2-minute training session that they do.
Wow. And so you're talking 4 minutes a week.
Yeah.
Wow. And
Yeah.
so that's obviously very doable. And that also makes me think that clinically, you have a lot of people going into physical therapy clinics, all kinds of clinics that are doing different kind of rehab and sports performance. And so that would also be very easy to implement in a clinical setting too, if you're simply needing someone to come in. People are already coming in twice a week. You just add 2 minutes to their session,
That's
and
right.
this could have astronomical results in terms of neck strength and stability and preventing future concussions.
That's right. Yeah, and it's proving very effective at treating those who are clinically symptomatic with concussion. Headaches, dizziness, post-traumatic migraine, stuff like that. We've got a study that the data collection done, the analysis done. We're just in the process of writing up. It was a randomized control trial where we took persistent post-concussion syndrome for greater than 4 weeks post-injury of 13-year-olds and above. So this is, if there's a high-risk population that you're going to be timid about experimenting on, it'd be a 13-year-old girl who suffered a sport-related concussion who's still suffering with headaches,
Mm-hmm.
4 weeks later.
Yeah.
And because the device is inherently safe, you can't get it going any faster than you are capable of getting it spinning. So whether that's whatever the limiting factor is, whether it's strength or neuromuscular control or balance or proprioception or coordination, it's a very small weight. It will not spin on its own. So it's kind of like a hula hoop. If someone's really good at hula
Mm.
hoop, it looks like they're barely moving and things just whipping around them.
Right,
Whereas if
right.
you can't do it, you're like, I can't get this thing up. What's going on here? Right. And so it's a similar kind of neuromuscular pattern. So it's
Mm.
inherently safe.
So this
And
is
we've
a hula hoop for the head.
yeah, pretty much. That's
Yeah.
right. That's right. And so with this study, it was a randomized control trial and 29 in each arm, and it was at least 4 weeks post injury. On average, it was closer to 3 months post injury, which is a critical window because at that point, when you've had a concussion and you've gone to like every doctor, physiotherapist, and oh yeah, it'll be better by 3 months. So like that 12-week mark, it'll be fine. But then it gets to that 12-week mark and they're not fine. And there's a significant uptick in anxiety. Like everyone's telling me I'll be better by now and I'm not better. Like what is going on?
Mm-hmm.
So when we looked at it, they were 72 days post-injury. So they're getting close to that danger zone, if you will. And one group got standard of care, which was referral to physiotherapy. And the other group got standard care, referral to physiotherapy, and Topspin360 to take home, train on it 2 minutes, twice a week for 8 weeks. At the end of the 8 weeks, the primary outcome measure was SCAT5 symptom scores. Like,
Mm-hmm.
where are you with all of these symptom profiles? And I know you're familiar with the
Yeah.
SCAT5 and
Mm-hmm.
the symptoms. And the intervention group had over 70% reduction in their SCAT5 symptom scores, whereas the control group actually had a 10% increase.
Wow, that's a huge difference.
Huge difference. Yeah. Yeah.
That's so exciting.
Yeah, it's been remarkable. And then the other ones we looked at was the neck disability index and the headache disability index, and
Mm-hmm.
both of those also improved dramatically, 35 and 40%.
So you're finding that even people who actively have neck pain are able to use this device, and it's actually improving their neck pain. And so that, because just when I watch you do it, it would seem like, oh, if someone has neck pain, that might create more neck pain, but you're actually finding the opposite.
Yeah, and again, because when I do it, I've done it a few times, so
Mhm.
I got the experience, and I can. Dennis like, whoa, and someone with neck pain looks at it and they're like, "There's no way I'm putting that crazy helmet on. Like, no way." And to be honest, that's actually probably a leading indicator that this will help them is when
Mm.
their visceral response is, "Oh, there's no way I'm putting that on."
Mhm.
Yeah,
Okay. And so there's a bit of a learning curve or a process of getting familiar with the device and how to use it. And I'm assuming, like you mentioned, you've used it a lot, so you can do it and it looks great, like you're an
yeah,
expert hula hooper. But when someone's starting out, you're finding their velocity is maybe a lot slower.
a lot slower. Yeah, I
Mm.
mean, so the first time average healthy adult female puts it on is around, they'll generate around 3 to 3.5 pounds of force per second. And average healthy adult male, first time, completely novel to it, no history of head or neck injury, is around 5.5 pounds. In my experience, and even with that study, the average RFD of someone who is, chronic neck pain, chronic headache, dizziness, migraine sufferer, they're less than 1 pound of force.
Okay. So you're kind of seeing what some of these initial metrics look like when people are starting out using the device and then how that improves over time.
Yeah, yeah, and it's again quite dramatic, and it's amazing how telling it is, like that initial value of where they are from a neuromuscular cervical perspective.
Mhm,
Yeah,
mhm. Yeah, amazing. And then super exciting, you actually won an award from the NFL, which was an Athlete Health and Safety Award. 1,100 companies basically applied to get this award, and you guys won it. So, A,
yeah,
congrats,
thank
and
you.
B, tell me a little bit about, what that experience was like and how that's helped you to maybe get into, more spaces and more opportunities and more teams and because it sounds like you've just got this incredible device that's making a huge difference in these athletes' lives. So, yeah, talk about that.
It was really exciting. So that was, I guess, back in a few years ago now, like 2019, and we applied for this, first and future innovations to advance athlete health and safety. And there's 1,100 other kind of that applied for it, and we got, I guess, top 5 with the applications. So we were flown down to Atlanta, where the Super Bowl was that year, and we got some prep and all this, and we presented on the Saturday before the Super Bowl. And Roger Goodell was there, and Larry Fitzgerald, and the whole panel, and kind of presented to them. And in the end, we ended up winning. So we got like $50,000 and 2 tickets to the Super Bowl. And
Nice.
yeah, and we're winners of the First and Future Award for Innovations to Advance Athlete Health and Safety. And yeah, it timing could have been better because very shortly after that, COVID hit and
Mm,
kind of shut everything down.
mhm.
But now that things have opened back up, yeah, we got our kind of first NFL football team to fully adopt and train the entire team, which was the Detroit Lions a couple years ago, and they went on to have a 0 head and neck injury season that year. So it was
Incredible.
really exciting. And, of note, they also went on to win their conference championship for the first time in over 30 years. They had the longest playoff win drought in the NFL at that time at 31 years. The last time they won, they had Barry Sanders as their running back. So
Mhm. Wow.
really,
Okay, so you might have had something to do with that.
it's, I'll tell you what, like, correlation is not causation, but yeah, things they hang out with us,
Yeah.
good things happen.
Yeah. Well, gosh, I feel like all of the teams need to be piling on and adopting this technology. Now, is this also available for just the average person who's been in a car accident, has had a neck injury, concussion? Like, can people purchase this device for home use? What is the
It is,
distribution at the
so
moment?
the a key thing to note, and this is like an advantage of it, is it's a piece of exercise equipment.
Hmm.
So similar to a treadmill, and you can use a treadmill to rehab kind of post concussion. The treadmill is not a medical device, but you can use it to treat various
Hmm.
conditions. So we
Sure.
do. It is a piece of exercise equipment, and again, the same kind of qualifications. Consult your healthcare practitioner before embarking
Right.
on it.
Yeah.
And in those cases, we end up like with me as a physiotherapist and my PhD in it. Generally, the avenue we like to take is to train healthcare practitioners how to use this device as therapeutic exercise to treat various conditions, just as you would, hey, you got a treadmill, let me show you how to do the concussion treadmill test.
Right. Mm-hmm. Got it.
So there is, the option for that. And it's, my clinical focus, although it's only part-time, I focus on the essentially 5, 10, sometimes 20-year history of chronic whiplash, chronic concussion, chronic dizziness, headaches, migraines. And it is really quite remarkable, the results that these long-standing patients will see with doing some appropriate neuromuscular training of the neck. Because in most cases, if they've done neck strengthening, it's, grab a TheraBand and kind of push it this way or that, or deep neck flexor and just kind of hold it there indefinitely, which doesn't translate to how the neck functionally works. And in some cases, it can be detrimental in other areas of neuromuscular control. So there's evidence that that type of strengthening is detrimental to proprioception, which is really key of what the neck's role is with the body. So the neck has the most proprioceptive fibers in the entire body, and that's not a waste of resources, because we walk on 2 feet, we need to know exactly where our head is in minute detail in order for us to not constantly be tripping and falling on our face.
Right. Yeah, absolutely. And so right now you're hoping to essentially kind of get this device into more clinical spaces in addition to like sports teams and then have people access it that way.
Yeah, exactly. I mean, there are, as I mentioned, people can, it is a piece of exercise equipment, but yeah, it's best because it's so novel and unique. Like it's not something that, oh, I get it, you put it on, you do this. It's not intuitive at all. Like there's literally nothing that you can compare to. Oh, it's just like doing this. Nope, it's not like anything. So that's one thing that we've learned is, because of the steep learning curve from a rehab capacity, again, the ones that we can help the most are also the ones that are most apprehensive about using it. So it requires just kind of, guidance and just proper assessment, clinical assessment, and prescription on how you'd use this piece of exercise equipment, just as any other kind of therapeutic exercise applied to the population.
Right. Since many people fall into the trap of thinking more is better, and you're saying you only need to do this 2 minutes twice a week, then that's also kind of important that maybe people aren't taking it and then doing it for 20 minutes every day.
Yeah, exactly. Well, the 2 minutes I get 1%, then I'll do it like 20 minutes and then I'll get 10%. It's like, yeah, no, it's not gonna work that way, And it's funny how, like, we're talking about this and it seems common sense, but like that is kind of what you run into with it. So it's like, yeah, you do have to be careful on how it's implemented.
Yeah, exactly. And I mean, I've fallen into that trap when those Vibram 5-finger like running shoes came out, over a decade ago. They're like, okay, only go for like maybe half a mile. I popped those things on and went for like a 5-mile trail run and gave myself Achilles tendonitis.
Yeah. Absolutely. Yeah. Oh, barefoot running. That's what you got to do.
Yeah, exactly. Let's go barefoot run through the woods for 5 miles. Like,
How much different is it from running with shoes? I know how to run.
So I could totally see myself popping this helmet on, being like, "All right, let's go, 10 minutes."
Let's sit down. Yeah. It's that's exactly the precaution.
Yeah,
because it is something. It's exercise, and if you overdo the exercise, you're gonna pay the price. Like the body will get better, but it's the late onset muscle soreness is, and especially in the neck with someone who suffers from headaches or migraines. If you go aggressively at it, it'll be like, oh, that triggered my migraine. Yeah, no kidding. Like this is targeting the exact area that is the source of your migraines, and you've just trained it quite aggressively. So yeah. At the same time, it's also confirmatory that this is targeting the tissues that are at fault.
Right. Yeah, your headaches are coming from your neck.
Absolutely. Yeah.
And amazing. So in addition to kind of seeing, so you've kind of talked about people are using this device, they're actually seeing less headaches, less migraines, less dizziness. I'm assuming improved balance as one of the markers too. Have you done any studies specifically looking at balance?
So I haven't, but there was a study that was done at Acadia University using Topspin and a healthy group of university students who, you always do your studies on. They did improve static standing balance with training on Topspin, and
Okay.
that's like which again clinically that's what I've seen is because I'll treat people with chronic dizziness and chronic headaches, chronic migraine. The average reduction in with my clinical population with training on Tossman is I use the headache disability index as a marker of their headache score and kind of impairment. And the average reduction in headache disability index is over 50% after the first month alone, and about 75% after the second month.
Wow, that's huge.
Yeah, yeah, and it's again kind of 2 minutes of training with that where they kind of see me and have their helmet. Then it's every other day because it's only 2 minutes of training and
Hmm.
they have it with them.
Hmm.
It's not like, oh, I've got to drive across town to put this helmet on for 2 minutes and drive back.
Yeah, yeah. And are there anybody that you would say, maybe isn't a good fit for this, at least at certain time points in their recovery or based on what they're dealing
Yeah.
with?
So basically, anyone who is like, I guess, acutely unstable neck. So if it's immediately after a whiplash and you haven't had that kind of ruled out and cleared, if you've got any active fractures at the point, and then the one screening test we recommend is it's the Sperling's compression test. So essentially, you put about 5 pounds of force through the spine, through the head and the neck, and if they can't tolerate that, like the weight of the helmet system is about
Mhm.
5 pounds. So you just, that's where you'd use some kind of manual therapy and, or acupuncture would like just to settle that system down until it can tolerate a bit of compression load.
Okay, gotcha. And then in terms of like ligament laxity, you mentioned whiplash. So if somebody does have a lot of cervical instability, a lot of ligament laxity, can this be helpful? Do they have to like do certain
Yeah,
things
very
prior
helpful
to
because
working up to it?
yeah, and no, and the reason it's very helpful in this in that like think about traditional ankle sprain where if you grade 3 ATFL rupture, so all of a sudden you've lost static stability of the ankle. Uh, you're not going to get surgery on that particular ligament. It's the most common one to be kind of fully ruptured. But what you are going to do is rehab it by not just strengthening the muscles. Like you're not going to get there by doing green TheraBand inversion and eversion, right? You've got to dynamically train those muscles to restore the function that you've now lost statically, dynamically. So the muscles now have to compensate for that lack of structural stability with dynamic stability. So with most rehab exercise you'll be doing progressively more challenging balance. So, standing on one foot solid ground, then on like a Bosu or like a foam Airex or something like that, and then getting into some like hops, two-legged hops, and then single-legged, and you start to dynamically load those tissues in order to normalize it and to get it to compensate. And that's where if you rehab it properly, then even though they no longer have that structural stability, that static stability, they are completely pain free and they're able to do all of their activities from before because they've retrained the brain to get the proprioceptive inputs from the muscles, no longer from the ligament that would tell them when it's off stretch.
Mm-hmm.
So the same thing applies for the neck is if you've got ligamentous laxity, then retrain the muscles around it to compensate and to essentially, yeah, compensate for that, and you can bring it up back to that level.
Incredible.
Mhm. Yeah,
Awesome.
it's been exciting.
Yeah, yeah. And so what are you seeing next? Like, do you have future research you want to do? Or are you just at this point kind of trying to raise awareness and get hopefully more teams to adopt this as a concussion prevention strategy?
Yeah, I mean, ideally, certainly as a increased injury resilience and even performance enhancement because it's also the neck is a kind of the last frontier of performance enhancement. Everyone's got leg day and everyone does chest and back, right? But
Yeah,
what's your neck day?
yeah,
And
yeah.
And trying to kind of bring that into the mainstream so that people appreciate that actually this plays a real significant role in sport performance. Because the more dynamically stable you are, the better you're going to be able to see the field and awareness of where your body is in relationship to other opponents or like the ball, the puck, the whatever object that you're playing with.
Mm-hmm. Yeah, yeah, the other guy's fist.
Yeah, yeah. Well, exactly. Yeah,
Hmm.
yeah. Being able to absorb that, like that's, yeah, certainly a big role in MMA or boxing because like every impact to the head is a high impact, fast,
Yeah.
movement that you've got to be able to dynamically stabilize against. So it's the nice thing is again, it gives you an actual metric value as to how stable, dynamically stable your neck is, and the higher it is, the more resilient you are to those impacts.
Yeah. I mean, I remember learning how to snowboard, and when you're learning how to snowboard, you constantly are like falling backwards and
Yeah.
falling forwards. And then you wake up the next day and your SCMs are just on
Oh, on
fire.
fire.
And I mean, you feel like you were in a car
Absolutely.
accident.
Yeah.
I
And commonly a mild headache, right? You're just like, oh man, yeah, catching the
yeah,
heel edge on like hard pack. Oh, yeah,
exactly. And even when you think about, again, like your head, crashing, your head is going back pretty quickly. Like
yeah,
those are pretty high velocity whiplashes you can get when you crash, snowboarding, wakeboarding, all of all of the
absolutely.
sports I used to do all the time, right?
Yeah, yeah. Oh, for sure. Yeah, and I mean, it's interesting because like even for me, I've got a 11-year-old son who wanted to play. He was playing flag football, and then he wanted to play contact football. And I said, yeah, that's fine, but not until you get to a safe level on my helmet. And sure enough, he did, and now he's playing contact. And oh, it's for me, it's peace of mind that
Mhm.
like, you know what, yeah, he even if he does, it's not going to make him concussion proof, but even if he does, he'll be resilient enough that it's not going to be like, oh my God, you're going to lose the next year of academic and you're going to be, feeling like you need a dark room. And everyone's like, nope, I'm pretty solid that you'll bounce back.
Yeah, yeah, that's amazing. This idea of you can have peace of mind if you've got yourself or your kids in sports, and you just want to know they're going to be safe and
Yeah,
protected. And
yeah,
mm,
yeah. So that's
excellent.
been certainly a big part. But yeah, no, because you've got a history with essentially martial arts and I mean, jujitsu is certainly one where kind of learning to fall would be key, but also kickboxing. Like, yeah, I mean, you've got a long neck and just a beautiful little target. That's
Exactly. Yep, I have a long lever there for
yeah,
my brain to get rattled.
right.
Yeah. Well, and in jujitsu, you're getting choked out too. There's a lot of neck trauma, and
Yeah,
I mean, people in jujitsu generally do have very strong necks because they are often on their back, but they're holding their head up as they're moving around. And so, I think jujitsu inherently does promote good neck strength, but
yeah.
to have that really quick, like you said, the fast twitch muscles also getting strengthened and being able to stabilize in the moment, I could see that as
Hmm.
a huge benefit too.
Yeah, yeah,
Gosh, well, that's amazing. So, your app that is associated with the device is basically measuring like the velocity, the rotations. It's tracking people over time. So, like somebody has an account that actually shows their
yeah,
improvements.
yeah. It
So,
time and date stamps all the training sessions, so you can very
mhm,
kind of quickly go through and you can track your progress over time. And the other neat thing is that it'll also like if you are like, oh geez, I was kind of flared up or had a cold or whatever, you'll see your scores drop in relationship to that because it is kind of quite sensitive to kind of how you're feeling that day, your energy levels, and yeah, and I mean if you've got some kind of late onset muscle soreness, it's going to kind of slow you
mm,
down a bit. So it is really kind of neat to see people kind of progress. Generally, they do improve quite, you know, almost linearly within reason, but you will see variations just on somewhat day to day on how they're feeling.
okay, amazing. So it's almost like sensitive, like a heart rate variability is. It can detect
Yeah,
subtle changes in how you're feeling that day.
exactly. Yeah, and
Wow.
especially and also if like we've got a kind of a case with before a volleyball player trained herself up to a very kind of stable level and then took a huge shot off the head, and everyone thought she got her hands up. It was like, oh no, that beat me right off the face. So the coach, okay, well, we've got test you for a concussion. I'm like, no, I'm fine. Took her out, test for it. She was fine. She cleared it. She went back into the game, finished the game. Coach followed, like, you sure you're fine? Yeah. Like, no, what's the big deal? 2 days later, when she went on her topspin score dropped significantly.
Mm-hmm.
And then like a couple days later, she was back up into a regular training kind of range. But it just goes to show that no, actually, her neck absorbed all of that, and
Ah,
it's going to need kind of a couple days to recover. Then she'll be fine. Now, had she played another game on that second day and took another hit to the head, chances are she would have been concussed, right? Because
right.
on that second day, her score on the toss one would have flagged her as higher risk.
Yeah. Yeah.
Yeah.
I had I'd given myself a concussion in March of this year, but what was interesting was that I was bending down to unplug something, and I stood back up, and there was a cabinet door that was open, and
Oh,
so I smacked the top of my head really hard into the cabinet door. The
yeah,
funny thing is that I had done the exact same thing, like either the month or two before. So I had done the exact same thing 4 to 6 weeks ago,
yeah.
and I was fine. But the second time I did it, it was immediately dizziness, nausea, headache, blurry vision. So yeah, it's that idea of like, you do
Yeah.
something once, you might be okay, but the same thing happens shortly after, and your body's like, okay.
Yeah, that's right. And actually, it's interesting because that's also what I think happened with Sidney Crosby. Because
Mhm.
like when he took that impact, like he was concussed or neck injury, but you see, it's like, ooh, that was a pretty significant injury. And then he seemed to be fine. He was back in like 4 days later, and then the next hit was into the boards. You look at it, you're like, really, that kept him out for almost a year? No, the first injury took away all his defenses, and then he's like just going around completely prone and
Yeah.
open, and that's what taking him out the second time. Yeah, now you're dealing with a lot of stuff you've got to rehab before you can get back to the game.
Yeah, yeah. Did you know my mentor, Dr. Carrick, was one of the people who was very instrumental in getting Sid
And his
Crosby
rehab.
over that concussion and back in
Yeah,
the game?
actually, I did know. Yeah, yeah,
Yeah,
that was pretty exciting.
yeah, yeah. He's incredible.
And so with because obviously you've kind of come around to focusing predominantly on concussion and the return, and the majority of that is from your own kind of personal journey.
I mean, initially when I started out, I focused on fertility, yes. And so
Yeah,
the first 7, 8 years I was in practice, I was doing women's health, fertility, hormones. During that time, I did rack up a lot of my own concussions. And so that's what led me to start studying functional neurology through the Carrick Institute, go back to school, get my doctorate degree where I was studying traumatic brain injuries. And so, yeah, that was all kind of my journey to heal my own brain
yeah,
and then recognize that, things like herbs and supplements only really get you a certain way.
yeah.
And then you really need the active neuro rehab. Like that's so
Mhm.
important. And so that really led me to trying to just get the word out there to more people who are, running into roadblocks in medicine. And so, yeah, once I fixed my own brain, and then, when I got that concussion in March, because I knew what to do, 10 days later, I was pretty much symptom free again. So
Yeah,
to say that on my 10th concussion that I healed in 10 days, I think is a testament to the fact that when you know what to do and you do it right away, you can get better and
yeah,
your brain can recover when you give it the right things.
yeah.
So,
No, absolutely. And it's yeah, you're exactly right. Because normally, kind of with each subsequent concussion, there's a much higher risk of it being a prolonged process.
mhm.
Yeah,
Mhm. Yeah. Yeah. I mean, I worked with a competitive half pipe snowboarder, and she said that she had been doing that for 13 years. And she's like, yeah, pretty much once a season, I probably get a concussion. I mean,
yeah,
it's just these things are so much more common, and people, I think, always hope that if they get it, they can just walk it off and be okay. But the idea that there's things that we can do to prevent them and prevent the severity of them,
yeah.
uh, so important. I just feel like, based on what I'm hearing, like every single sports team needs one of these helmets.
Yeah, absolutely. I mean, yeah. I mean, the results that we're seeing, it's mind boggling, but it's also kind of like selling insurance, right? It's
Mm,
just like
mhm,
prevention
mhm.
is surprisingly, it's a tough sell. because they're like, no, I think we were okay with that. We didn't have that many, concussions last year. They almost don't want to, admit to it. It's like, oh, okay.
Hmm.
So,
Right.
but the performance enhancement side is quite beneficial. So we'll probably focus on that with the Topspin360, and then
Mhm.
more of the rehab side, using therapeutic exercise to treat and
Right.
kind of enhance that.
It's almost like the concussion prevention is the added bonus to enhancing your
That's exactly
performance.
right. Yep, totally improved injury resilience, and chances are your team's going to win your championship. Really?
Right. Right. Yep. That makes it easier to sell right there.
It does, absolutely. So yeah,
Awesome.
so
And
that's been predominantly the journey.
are you making these helmets in different sizes? I mean, like I know
Yeah,
my nephew when he was 8 needed adult helmets because he had a huge head, but that's not all kids' cases. So do you
yeah,
have it in different sizes?
we do. So we've got small, medium, large, and extra large. And like a medium and a large will generally cover about 80% of the population. And then extra large, obviously, for the kind of larger individuals, and then small for either usually kind of petite females or the pediatric
Mhm.
population.
Okay. Excellent.
Yeah, and
And
no,
then
actually, with you asked about research. So we do
Mhm.
have, like if you Google Topspin360 in the Mayo Clinic, like they're currently doing a research study looking at injury prevention in hockey players, competitive hockey players, and so we've got kind of a few other kind of studies. One in Calgary looking at incorporating Topspin with other approaches for concussion and lower extremity injury risk reduction. So far, the preliminary results are quite dramatic and encouraging for sure.
yeah, that's so exciting.
Hmm.
Well, I can't wait to stay on top of the research, see what else is coming out. And then why don't you let people know kind of where they can find you, more information about the device if they're interested in bringing that into their clinic or their sports team?
Sure. So with the device, it'd be topspin360.com is like our website. To learn more about me, probably easiest would be on LinkedIn. So Theo Versteegh on LinkedIn, and then they can subscribe to my newsletter, Next to Impossible. So we'll talk about the neck, and then neckrevolution.com is where I talk more about the rehab side, and like the consultancy for people who are struggling. The nice thing that's really rewarding for me is that because the patient population I deal with are 5-10 years out, in pretty much every case, when they get to me, they've seen everyone under the sun, which makes it really easy because if they haven't gotten better with seeing these often 20 plus practitioners, it makes me more confident that I can get them better, because if it was anything else, the one of the other 20 practitioners would have found it and treated it and they'd be better by now. So it's a bit of a kind of, I guess, litmus test is how many people they've seen for it, and the more people they've seen, the more confident I am that I can get them better, because this is the one thing that no one else is able to do right now. So
Right, right.
it's been quite rewarding.
Yeah, you've got the missing link there.
Yeah, yeah.
Mhm. So talk a little bit more about your clinical practice. Are you seeing primarily people with post-concussion syndrome? Is that kind of the basis of your patient population?
Yeah, long-standing, like I said, generally, I think the average is definitely 5 to 8 years
Wow.
post-injury. Many cases kind of 10 to 15 years. And the other ones, that I find great results with are those who have specifically post-traumatic headache or migraine, and the ones who are being treated with who get some relief from Botox injections. And the reason being is that for when you're doing injections, Botox injections for the treatment of headache and or migraine, where they focus on is the neck, and they end up
Mhm.
like it's I mean, it's just I hope to God in many years people will look back and compare injecting Botox to treat migraine as leeches, because like in what, like literally, it's they shortened it to Botox because it's botulinum toxin, and they are literally injecting it to kill the nerve in the muscle.
Yeah, and
How
then
is
people go in indefinitely every 3 months to do
yeah,
it. So I'm
that's
like,
exactly
clearly
right.
it's not fixing the problem
It's
if you have to
not,
go in every 3 months.
because the body, each time you do it, you're like, and then it's like, okay, I guess we're regrowing these again. Why do you keep killing them, right? And then it's like,
Mhm.
oh, it's coming back. Oh, we'll kill them again. What? Yeah. So I've got several cases with, yeah, three so far that actually, like in all three cases where there were years of Botox injections, they are completely off of Botox. And like, to quote one, it's as if the accident never happened. And
Mm.
again, it's because, yeah, as opposed to, you know, killing the thing that's causing you the symptoms because it's telling you something's wrong, why don't you try fixing what's wrong? And oh, wow, all of a sudden now you don't need Botox anymore.
Yeah, yeah. I mean, I use a pulsed radio frequency kind of peripheral nerve stimulator to try to help restore health to the greater occipital nerve, lesser
Yeah.
occipital
Yes.
nerve. But to be
Yep.
able to pair that with the actual neck strengthening component, it's
Yep.
like, oh, now I feel like I can knock this out of the park.
Honestly, you would. It would completely, yeah, change and improve like that demographic that you're using that on,
Hmm. Hmm.
because where the occipital nerve comes out of, it's essentially the top vertebrae comes from behind. And if you've got unstable there and you're constantly kind of hammering on it because you don't have that dynamic movement properly with the neck, you restore that. You take that every now and then, pressure off the occipital nerve. Oh, wow. Hey, their migraines have gone away. Yeah.
Yeah, yeah. No, that makes so much sense. And definitely I have the patient population where they'd probably look at that helmet and go, nope.
No, there's no way. Yeah. Yeah. It's like, oh, perfect. Yeah. Yeah. I
Yeah.
mean, yeah, I'd be happy if you want to even play around with the case study and just do before and after. And it'll be like,
Mm.
you'll see the results in, like I said, after the first month, it's usually about 50%. After the second month, it's about 75% on that headache kind of population, especially those ones that have that history of Botox.
Yeah, well, and so many clinicians who work with this patient population, if they're being super honest, will absolutely tell you that those post-traumatic headaches can be so stubborn.
Yeah. Yeah.
And
Yeah.
like you're saying, I mean, people are coming to you 8 to 15 years after their concussion and still symptomatic. So,
Yeah. No,
yeah.
exactly. And it's still, at the point of daily headaches and daily, I had one who was, she was saying that after treatment, she didn't realize how much time and effort it was taking to manage her symptoms. Like it was like a part-time job because, like, oh, hey, do you want to go out this Friday? It was Wednesday. It's like, I have no idea what Friday is going to be like. Like if it was today, I'd be okay. I don't know what Thursday and Friday are going to bring. So yeah, let's pencil that in. And
Yeah, yeah. No, that chronic pain, it just robs you. I mean, I had to have a fusion on my lumbar spine, but for 7.5 years, I had daily chronic, horrible low back pain from the age of like 28 to 35. And that just robbed me of some of like the best years of my life where
it
every single
will.
thing I did was painful.
Yeah.
And so I feel, my heart goes out to people who have chronic pain because it's hard to just be at ease in the world. It just takes so much away from you.
Oh, yeah, I agree. And the other challenging thing is that I find a lot of chronic pain kind of research and direction, specifically with neck pain, is because, you know, until now there haven't been effective treatment approaches for it. A lot of it has been reframing, blaming the patient, in that
Mm,
like it's even with the explained pain, it's like, oh well, it's we look at it, there's nothing wrong, you turn your head here and it causes pain. It's because your like pain fibers have been hypersensitive and it's not actually dangerous, but it's just telling you that it is. So we've got to retrain that to let it learn that it's not. It's like, no, when you turn it, it hurts, it's causing pain. That's the problem. Retrain so that it doesn't cause pain when they do that anymore.
mm,
And like, I've got evidence that you can do that. And if you just objectively measure their multiplanar range of motion, see where that sits compared to healthy adult male or female averages, and then multiplanar static neck strength and see where that is, treat it, get those better, and miraculously their symptoms improve too. So it's just, you, yeah, treat the right things.
Yeah, yeah. And that's, I think, what you just mentioned about like patients. The last thing you want to do is make them feel guilty or blame them for their
Yeah,
experience when they don't want this. They're not asking for this. They just
yeah,
want their life back. So,
exactly.
yeah.
Yeah. And
Mm,
just, saying that, oh, it's because, you've got hypersensitive pain fibers. It's like, no, there's something that's pinching, that's causing the pain. That, like, it's not hypersensitive. It's that's what it's there for, is to tell me when I'm doing something that's causing pain.
yeah. Yeah. Man, well, gosh, I'm so excited for you, for this device, for the world to be able to have the device. Uh, so I will put all of that information in the show notes. Well, thank you so much for coming on the show. I can't wait to share this episode with everybody. Very, very grateful that you came up with this device, but congratulations on winning that award and getting this out into the world.
Thank you so much. Yeah, and thanks so much for having me. It's been a blast.
Yes, absolutely.